iPrevent viewers! Things are reopening after around 2 months of staying at home, and we want you to stay as healthy and safe as possible. Although non-essential businesses like shopping malls, theaters, restaurants, hair salons, barbershops, and others are opening back up, we cannot forget that there is no vaccine or cure for COVID-19 yet, and the virus has not gone away. So, along with the 25% occupancy that businesses are supposed to enforce, and as restrictions start to loosen, it is super important that we continue to practice necessary steps to minimize spread of the virus. This is extremely important to remember because we want to prevent spreading it to those who are more vulnerable, especially the elderly and the immunocompromised. Also, you don't know how your own body will respond to the virus if you get it. Reopening does not mean everything goes back to like it was before. Social distancing and staying at home has been working to flatten the curve. This is why we are able to slowly do more things outside of our homes if healthy behaviors continue to be practiced. Remember, people can have the virus but be asymptomatic, so everyone needs to continue to do their part in protecting themselves and others. Some precautionary behaviors to adopt are: do stay at home as much as possible except when needed. Do stay 6 feet apart from other people when you go out. Do wear a mask, not just to avoid yourself from catching the virus, but also to prevent spreading it if you have it unknowingly. If you have a disposable mask, do not use it multiple times. They are meant to be single use. If you are using a cloth mask or a face covering, remember to wash it often. Run it in the laundry with hot water. Why are distance and masks so important? The virus is mainly spread person to person. It travels in respiratory droplets when someone talks, coughs, or sneezes. It can also travel through an intermediary surface when someone coughs into their hand and then touches a surface like a doorknob, and someone else touches the same doorknob and then touches their nose, eyes, or mouth. A mask prevents the virus from traveling through respiratory droplets when someone who is infected is wearing a mask. Wearing a mask also prevents those droplets from being inhaled by another person. The protective effect of masks is maximized when all parties wear a mask. Do continue to wash your hands often before leaving the house, after returning home, and before eating. Don't break the habit of washing your hands. Wash for 20 seconds with water and soap. If there is no soap and water around, use a minimum 60% alcohol solution hand sanitizer. Then wash your hands with soap and water at home. Soap and water is still the best practice to disinfect your hands. Wash your hands or use hand sanitizer after handling money, filling up gas, using public transportation, touching the grocery store cart, etc. Do stay at home if you feel sick with a fever, cough, or shortness of breath, symptoms of COVID-19. Do use curbside pickup that restaurants and stores have implemented to avoid exposure and contact. Do order groceries, prescriptions, or other goods and services online whenever possible. Do continue to do activities outdoors instead of indoors if possible for recreational activities. Walk, run, or do other forms of exercise at the park instead of in the gym. Do keep hand sanitizer on you. Do cough or sneeze into tissues and discard the tissues right away. Then wash your hands. Do use alternative ways of greeting in place of a handshake, like waving or showing a peace sign. Do clean and disinfect surfaces often. Tables, doorknobs, light switches, phones, keyboards, handles and steering wheels of your cars. Do use contactless payment whenever possible. Do use telemedicine if possible. Do improve ventilation in offices and in vehicles. Behaviors to avoid. Do not gather in groups for socializing or for parties. Do not touch your eyes, nose, or mouth with unwashed hands. Do not stay in close contact with those who are sick, even when inside the home. Try to keep a distance of 6 feet between you and the person. Do not go closer than 6 feet to others while outside. Do not let a child younger than 2 years old wear a mask, or anyone who has trouble breathing or moving. Do not use a mask meant for a healthcare worker. Do not cough into the air or in your hands. Cough into a tissue, ideally, otherwise into your elbow. Do not touch surfaces unnecessarily. Extra precaution and care need to be taken as we start to return to doing more activities outside of our homes. This protects ourselves as well as others, including essential and non-essential workers, the elderly, and the immunocompromised, as we engage back in the community. The iPrevent team supports Black Lives Matter, and we support those who go out to engage in community activism. Important action needs to be taken in the name of justice and equity through spreading awareness and consistently pushing for reform. Make sure to register to vote in upcoming local and national elections. While staying informed and engaged, we want you to stay as healthy as possible, physically and mentally. The iPrevent team will return to serve the community through health events, while implementing social distancing and the use of masks, hand washing, and cleaning and disinfecting. Our events can be found on the iPrevent calendar at www.iprevent.org or on our social media platforms, Instagram, Facebook, and Twitter at iPrevent_OHL. As always, give us a call at 504-418-4955 for primary care, detox, residential, and prevention services.